Hi, I'm Caleb Tiller, and I'm here at the mHealth Summit Digital Media Pavilion. I'm here with Chris Bailey of the World Health Organization, and Chris works on eHealth for the WHO, which is the leading organization on health for the UN. So, Chris, thank you so much for being here today.
My pleasure.
We're thrilled to have you, and I think you bring a really different perspective for some of our audience, which is really helpful. You can talk a little bit about policies and standards, which may be things that everyday people aren't thinking about. So I think a good place to start for the YouTube audience is what does that mean? What are policies and standards that WHO is working on for eHealth?
Well, I think, first of all, in eHealth, most of the standards pre-existed our involvement. They came out of the sector. One exception with that would be the International Classification of Diseases, the ICD, which is a WHO standard. But I think from an everyday person's perspective, it really boils down to when a child is born, in order to provide care and make them part of a system, they need to have an identification number. Okay. That number needs to be stored in a coherent way and transferred to, if let's say they're born and a drug is needed to help treat that baby, that information about the baby needs to transfer to the pharmacy. That pharmacy needs to be able to transfer that information to the stock area and have it ordered properly, etc. So all those things involve standards if that's going to happen in an efficient and time-effective way. Particularly in an mHealth environment, what's important is that we not get stuck on the technology side of it. So when we go to country and we talk to implementers, donors, governments as partners of how to do this efficiently, with mHealth in particular, there's a tendency sometimes to have a little pilot here and a pilot there. Countries often suffer by this pilotitis, fragmented systems that don't actually add up to a holistic national health information system. And so by using standards, you can help break through that. But more importantly, by actually getting people to talk to each other and start discussing what are the information needs between different parts of the health sector. What does the district health officer need from the labs, from the clinic, from the community health worker, etc. And begin to define, okay, if this is the set of information that I need, you can start actually planning what are the appropriate standards and how can that information flow, so you can hand that to an engineer and they can design systems that will actually communicate with each other. But first, the people have to communicate. The IT systems have to reflect the communication and the collaboration between humans.